Something terrible happens. Someone you love is hurting, or maybe it's you. You're overwhelmed, you're breaking inside, and you want to cry. You need to cry, but nothing comes out. Your chest is tight, your throat burns, your eyes sting, but they stay dry. And everyone around you thinks you don't care, that you're cold, unfeeling. But the truth is worse. You feel everything. You just can't release it. If this is you, you're not broken, but your relationship with emotions might be. Because people who can't cry aren't emotionless. They're often feeling more than anyone realizes. Their body just won't let them show it. And psychologically, there are specific reasons why this happens. Here's what's actually going on. Crying is a physical release mechanism. When emotions become overwhelming, your body is supposed to discharge that tension through tears. It's how humans process grief, stress, frustration, even relief. But for some people, that mechanism doesn't work. Not because they don't feel, but because somewhere along the way, their nervous system learned to suppress the release. And this usually starts in childhood. Maybe you grew up in an environment where crying was seen as weakness. Maybe someone told you to stop crying, to toughen up, to control yourself. And your brain learned that crying equals danger, rejection, punishment. So it shut the mechanism down. Not consciously, automatically, as a survival response. Or maybe you experienced something traumatic. And during that experience, you couldn't afford to break down. You had to stay functional, stay in control. So your nervous system froze the crying response, and it never unfroze. Now, even when you're safe, even when you want to cry, your body stays locked in that protective mode. There's also a psychological pattern called alexithymia. It's the difficulty identifying and describing emotions. People with alexithymia feel emotions intensely, but they can't name them, can't locate them in their body, can't express them. So the emotion stays trapped, building pressure with no outlet. And crying requires emotional awareness. You have to recognize what you're feeling to release it. If your brain can't identify the emotion, it can't trigger the tears. But here's what makes this even more difficult. Society reads dry eyes as indifference. When you don't cry at a funeral, people think you didn't care. When you don't cry during an argument, people think you're not affected. But the reality is often the opposite. You might be feeling so much that your system is completely overwhelmed. Shutdown is not the same as not caring. It's a nervous system response to unbearable emotional intensity. And this creates a painful cycle. You can't cry, so people think you're cold. So you feel more isolated, more misunderstood, which creates more emotional pain, which you still can't release. The inability to cry doesn't just block tears, it blocks connection, because humans connect through vulnerability. And tears are one of the most universal signals of emotional openness. But here's what most people don't understand. Not crying doesn't mean you're not processing. Your body might be releasing emotion in other ways, through tension, through exhaustion, through physical pain. Some people who can't cry experience chronic headaches, chest tightness, muscle pain, because the emotional energy has to go somewhere. If it can't come out through tears, it comes out through the body. So if you're someone who can't cry even when you desperately want to, understand this. You're not defective. You're not emotionless. Your nervous system learned to protect you in a way that no longer serves you. And unlearning that takes time. It takes safety. It takes permission to feel without judgment. Sometimes crying comes back slowly, through therapy, through safe relationships, through practices that help your nervous system feel safe enough to release. And sometimes it doesn't come back at all. And that's okay too, because emotional release doesn't have to look like tears. It can look like honest conversation, creative expression, movement, connection. The goal isn't to force yourself to cry. It's to recognize that your inability to cry is not a moral failing. It's a learned protection. And whether or not you ever cry again, you deserve to be understood, not judged for the way your body has learned to survive. If this resonated, subscribe, because we're exploring the psychology of emotional experiences that people don't talk about enough. And maybe understanding why you feel the way you do will help you be a little gentler with yourself.